Joining me right now is one of my favorite doctors, Dr. Natalie Koptyev joins us right now. She's a doctor of pharmacology. She's also somewhat of an expert in the cannabis area, which we'll get to a little later. Dr. Nat, how are you?
Hi, how's it going?
So the last time I saw you, you were at the studio, and we wanted to have you on, but your former employer did not want you to be introduced to the world. And then I have spent probably the last 6 months trying to get you back on the show. Yesterday you left us hanging, and now today we finally did it. So thank goodness for that.
Yeah.
So you are a great pharmacist. You've been working in pharmacies. You worked, I know, for the cannabis company. And just, you know, I was asking you, I don't understand, knowing pharmacists, why hydroxychloroquine and its active agent plaquenil are used in commonly prescribed drugs. Why are they so reluctant to allow people to take hydroxychloroquine to the point where the FDA has said that doctors shouldn't prescribe it?
So, first of all, with hydroxychloroquine, it's immunosuppressive drug. So it is used for malaria, arthritis, lupus, and a lot of them are saying that it decreases viral load for COVID-19 patients. Unfortunately, with hydroxychloroquine, there's a ton of interactions that people don't know about. Heart medications, alcohol, which is, you know, obviously everyone drinks, insulin, anti-seizure medications, certain side effects like can worsen skin conditions like psoriasis, eczema, can cause high damage to the eyes in high doses, can also be very fatal. So if you're on an antiarrhythmic drug, can cause, you know, stuff like QT prolongation, can cause murmurs. So obviously the FDA kind of had the risks outweighed the benefits. So they took it out of emergency use authorization.
So, Nat, Doc, let me ask you this. I understand what you're saying, but doesn't the doctor ultimately have to know his patient? And if a doctor says, all right, I know some of the studies say this increases heart rate, arrhythmia, you know, some people, you know, maybe with a heart condition or blood pressure, I can't give it to them. But shouldn't the doctor be an arbiter of his license? He's licensed, he's taken an oath. Shouldn't the doctor be an arbiter of knowing what his patient can handle?
Yeah, but the thing is, a lot of patients are asking their doctor, can you prescribe me this medication because I want it for preventative measures? A lot of people are walking around not even knowing that they have heart conditions or even arrhythmias. Not every person has to be put on a medication if they have an arrhythmia or any sort of, you know, abnormality of the heart. So a lot of these doctors are prescribing hydroxychloroquine for preventative measures, not even knowing that these patients have any sort of heart conditions. A lot of obese patients don't know that they have these conditions. So it can be dangerous if they're taking it for prevention reasons, because they can be taking it more than 2 weeks at a time, maybe even more. And obviously taking it for longer periods of time, not treating a certain condition like, let's say, lupus or arthritis, can be detrimental. So there's actually, there was a huge case study published in Brazil, I believe. It was through the New England Journal of Medicine. Very reputable source. I mean, when I was in pharmacy school, I was always looking through that journal. They studied, I believe, close to 700 patients over 18 years old. And they started noticing that the use of hydroxychloroquine with azithromycin, which is technically used for upper respiratory infections, did not improve clinical status at a 15-day compared with standard of care. Standard of care being oxygen therapy, you know, any other therapy without medication. So basically, it concluded that a lot of these patients had heart conditions that they didn't even know about and had detrimental side effects. So they really didn't see much of a difference taking the medication versus not taking the medication. So like I said, the FDA made this decision to revoke it So if you are in a hospital setting where you're being monitored, specifically, obviously your heart is being monitored. Also, another thing that they've noticed was liver enzymes were going up. And, obviously that has to be monitored. You can't get monitored at home when you're taking these medications. So they're saying that if you're in a hospital setting or if you're put on a clinical trial, that's the only time you should be taking hydroxychloroquine.
So,
unfortunately,
back in 2005, Dr. Anthony Fauci actually put out a paper related to SARS. And he said in 2005 that hydroxychloroquine did demonstrate some prophylactic effects in attacking the SARS coronavirus. I know it wasn't the COVID-19, but what do you think changed from 2005 till now?
It's hard to really say. I mean, obviously he's a very, very smart doctor. He's been around even through, the HIV decade. There's definitely something behind it, because if you kind of look at it, hydroxychloroquine is used for prevention of malaria. So someone who's traveling to, let's say, Africa or any country that has, high prevalence of malaria, the doctor is allowed to put them on hydroxychloroquine for about 2 weeks before they even enter the country. Mm-hmm. So if you kind of think about it, yes, there is some sort of background to it as to why hydroxychloroquine can help with that. But again, there's not enough studies done specific.
Mostly anecdotal. The big study that everyone's talking about is this Brazilian study of 700 people. I get it. You know what I mean? I just don't know how some of these doctors are out there putting their name and their license on the line saying that it works for them. So it's strange. But listen, we got a minute left. I want to ask you this. I know you're kind of an expert in cannabis. Are there any positive effects to using cannabis to fend off the coronavirus?
Again, studies. FDA still hasn't approved cannabis as a treatment for any sort of conditions. It's still a very holistic approach. I think it definitely has a calming effect on someone's body. So I think, obviously, alcohol and marijuana have been.
Okay, so that's not her medical opinion, but I think we would all roundly agree that if you have anxiety about COVID, some alcohol and cannabis may or may not help, but it probably won't hurt unless you abuse it.
Again, there's no clear studies yet with marijuana. It's still not FDA approved.
All right.
Beneficial for the anxiety, the stress, and just more of a calming effect for people who.
Nat, thank you so much. That's Dr. Natalie Koptyev. She's one of the great friends of the show, and now hopefully we can get her back more often.